Welcome to the Regen Doc podcast, powered by dynamicathlete.com. I'm your host, Dr. Aneesh Garg. I'm Yale trained, Andrews trained, and a two-sport U.S. national team doctor here to help you make sense of regenerative medicine. The dynamic athlete story. What if I told you we moved to Boulder knowing no one? We stayed above somebody's garage and built a practice out of thin air. This is that story.
You had the credentials to work anywhere. What made you choose Boulder?
I thought we could make a difference. I think that was the big draw. There's a hugely active population here. We started to do our homework and realized there's a ton of orthopedic surgeons here. There's a ton of chiropractors. There's a ton of physical therapists. But there isn't a lot of what we do, and certainly not in terms of what we're doing now in this area. And that was the biggest draw. When we had talked about coming out here and looking at what this model is in general, where people see an orthopedic surgeon and they get really this paradigm of treatment where they see a physical therapist, they may get a steroid injection, they may end up getting surgery. And Boulder's a great place with people that are searching for alternatives to the status quo or whatever the current paradigm is. So my training, I did my fellowship at Andrews in Birmingham. So those of you who know sports know about Andrews in Alabama. And a new patient doesn't see the orthopedic surgeons. They see the non-surgical physicians. These are some of the best orthopedic surgeons in the country. And being able to look at that and understand why that works is hugely important in how you take care of patients. The emphasis at one of the top places in the country is to go the non-surgical route first. And then if you need surgery, you come and see us. That's what was instilled. And so when you start to see that there's an overwhelming majority of orthopedic surgeons in a particular area, then you start to realize, maybe we can make a difference here. So I think that was really the big component. And I think we saw an opportunity to be a resource for the community. And I think that was really something that made a difference in terms of, from a day-to-day standpoint, how can you make a difference in your community? And that's what we targeted. So I think coming out here, having known no one, and building a practice out of thin air is based on community support and really trying to do things for the right reason. And I'll take you through sort of our original timeline. So we'd come out here and we were looking at really just the options and the landscape and all that. And then you start to understand, maybe this is a place that we could call home and do some good work.
Don't patients need to see the surgeon first to know if they need surgery?
Well, I think that's backwards, right? In an area where you're trying to get back and heal quicker, you would think that the route should be, well, I'm going to go see what I can do non-surgically. And then if I need surgery, then I need surgery. But it's backwards. In no other specialty in medicine do you see a surgeon first. For example, if you have a headache, do you see a neurosurgeon first? Right? The answer would be no, that's ridiculous. Why would I go do that? My father and sister, they're both cardiologists, and I use this example whenever I go lecture, and I said, if you have a heart murmur, do you go see a cardiothoracic surgeon first? And then people look at you like, no, that's absurd. Why would you even bring that up? And then I say, well, when you have a knee injury, why do you see an orthopedic surgeon first? And then they look at me and they are dumbfounded. They're like, I don't know. I didn't know there was another option. This is where people fall into this treatment gap. This is the other option. And I think that's where the system is sort of broken here, where, from my standpoint, having worked with orthopedic surgeons in fellowship, I understand the surgical indications for things. So I can very confidently tell someone, hey, I don't think there's a surgical indication here, or hey, I think you need surgery here. And I'm not sure everybody does that. And I think at the end of the day, you have to look out for who's in front of you. And so I think in anything, there's good and bad in anything, right? There's good and bad non-surgical physicians, or just good and bad orthopedic surgeons. I mean, I think that go on and on. And I think you just have to look at it when you're doing what you want to do and you're looking out for the best interest of the patient, then I think you can sleep well at night. And I think that's what our target goal was. So for us, it's how do you look at this and have them get back and buy back time and recover faster than surgery. I mean, over 90% of these injuries don't actually require surgery. And that's from the American Medical Society of Sports Medicine. That's not my number. So imagine over 90% of these don't require surgery. But we're going in a route that's backwards. So that's where we thought we could make a difference. So if any of this is interesting to you and you're like, I should listen or hear more about this or read more about this, go to dynamicathlete.com, read about all the things that we're doing, and make sure you keep listening to the Regen Doc podcast for more information and trying to make sense of regenerative medicine.
So you just packed up and moved to Boulder? How did that happen?
It's crazy, right? I mean, I think anytime you look to build something, you want to make sure you're doing your homework and going about it. So we'll take you through a little bit. So we'd come out for a visit and try to get the lay of the land and the landscape. And then we went on vacation. It was Nicole's birthday and we were on vacation. And when you splurge a little bit and you get a massage on the beach and you hear the waves crashing, if you have not done that, I recommend you doing that. But so it's worth it to pay a little bit extra to do that. And so after we had visited Boulder, we were on vacation, and then after the massage, which the whole hour, all I kept thinking about was, how do we go build something in Boulder? So we sat on the beach and I turned to Nicole and I said, what if we go build something in Boulder? And she's like, okay, I'm in. So we packed up our car, which we were in Nashville at the time, and drove to Boulder and arrived in Colorado on September 28th, 2022. And we move into a 1-bedroom, 1-bath carriage house above somebody's garage. Tiny. But we were here. And then so we started to do our homework, and this is sort of where we looked at what the opportunities might be. When we had come out previously, prior to the vacation and just kind of hanging out in and around Boulder, we went to the YMCA in Lafayette, which Mo is a big fan of YMCAs, and they happen to have a hockey rink there, and just it was pretty influential because we got a day pass and we went to the pool and we started talking to people, and they asked me what I did, and I told them, and they said, you should move out here yesterday. And I was like, what do you mean? And they were like, we don't have somebody that does what you do to the level you do it at, and all the stuff that you're talking about would be fantastic for this population here. And and I think we started to do again. We started doing our homework, and I think there's a lot of good people that do a lot of really good work in this community. I think we do things a little bit differently, and I think we can help people in a different way. And so we started looking into this, and I was like, okay, Like, let's do this. And so we arrive, and then for 3 months, we look and make sure that we're doing the right thing. And are we going about it? Is this a mistake? Should we be doing this? And we went and looked for a bunch of places to have our office and finally settled on one. And we signed a 10-year lease. We didn't know a single person here. We're building a practice with no network, and we just signed a 10-year lease while staying in Airbnbs. We don't even have a place to live. That's our own. It sounds crazy even when I say it right now to think about what we did. But that's what we did. And then the reason that I wanted to sign a 10-year lease was I told everybody that we signed a 10-year lease. I wanted people to know that we wanted to be part of the fabric of the community, that this is not a stint, we're in, and we're not going anywhere. And I think that's part of that mentality, not only for me, but everybody that's been a part of our group. Like, we're here. Like, we're here to make a difference. And so that was a big thing for us, was signing that lease and being like, okay, we're committed. I mean, Nicole and I haven't lived in a place for like 5 years. I don't know, ever maybe. And so outside of like where you grew up, and to sign a 10-year commitment, and you sort of look at it and it's okay, like, we're here. And, we ended up buying a house and all that, but that was the origin, was we're going to sign a 10-year lease and we're going to get going. And even if it was in a temporary workspace while our new place was getting filled out, it was certainly an adventure to get started.
Who was the first patient that made you think, this is why I did this?
Yeah, I mean, look, we take care of pro athletes, and we take care of the whole spectrum of people. There's a sign in our office that talks about everybody's a dynamic athlete here in some shape or form. And our very first procedure was in our temporary space. So mind you, our space is getting worked on, and we're looking at seeing some people in there in our temporary space. This woman said, my knee hurts, and we examined her. We actually had our ultrasounds. We're scanning her. She had some thickening of her patellar tendon, and I felt like PRP would be a good option here as we were kind of going through it. And I asked her, I said, do you want to wait till our space is open? We can get you in and then do that. And she said, no, I want to do it now. And I said, what's the rush? What are we trying to get back to? And she said, gardening season. And I looked at her and I said, okay, that's your sport. And that's what we did. And so we ended up doing a PRP injection. We ended up getting her back to gardening season. So imagine that, like, sports, or what's important to you, is what's important to you, not to me, not to anybody else. All that matters to us is what's important to you, and what are we trying to get you back for? I mean, I had somebody who was a dancer, and they were like, well, what's my return to heels after a knee injury? And I said, I've never had a return to heels program, but let's work through this. And so that's what's important to them. And so I think, we've had an Olympian that's like, I'm leaving for the Olympics in 10 days. What do you have? And so we have to truncate and change what we're doing. And then we have these other situations. So I think that from a patient experience standpoint, that's one that really sticks out. And I think what allows us to do that is how much time that we spend with people. We spend an hour, if not more, with new patients, because we're trying to figure out all these things. I can't tell you how many second, third, fourth opinions, fifth opinions, you name it, that we've seen. And people that have gone to big time places, really well-known places, and have come to see us for second opinions and have ended up staying with us. And a lot of it has to do is they feel heard, they feel seen, and they don't feel like a number. And I think by design, our clinic is designed to feel warm and safe and a good place to heal. And with our whole team, and you get taken care of by our whole team. I said this on another podcast where people come in and they get a procedure done. They just look around. We have students, we have interns, we've got everybody that takes care of the patient. And I often refer to it as a NASCAR team. Like, you're taking care of a person with an entire team, where it's not just me, or it's not just one person, it's the entire team. And that's how we do it, where you're building relationships first and then you're taking care of people second. And so I think that was really a big thing for us in terms of, from a patient experience standpoint, is we're taking the time to get to know who you are and what's important to you and why you have what you have and what are we going to do about it.
Looking back from the Airbnb to where Dynamic Athlete is today, what would you tell yourself?
Well, it's going to be harder than you think. It's going to take longer than you planned. It's going to cost more than you budgeted. But do it anyway. The impact that you're going to make on this community is profound. And that's what drives us. You know, we have people that come in and have had years of pain, haven't been able to figure it out. And then they leave our office a different person. Like, you see the joy back in their face. Like, I can go do what I want to go do, or something that brings me joy. And we see this on a daily basis, but it never gets old. So I think really being a difference maker in the community and a resource in the community has been really exciting. And I'm really proud of our group, where we have really good people that believe in what we're doing, and our entire group works towards, how do we get our person back, right? So I say this all the time when I'm seeing people, and I said, if you're in my family, this is what I would tell you to do, right? There was somebody who walked into our office and said, here's $5,000. Can you fix me? Like, I want to do what you have here. And I said, please don't anybody take your money. And I use this phrase all the time. I said, to the financial detriment of this clinic, I'm telling you, please don't do this. You're going to need surgery here. We can help you before, we can help you after, but to fix your problem, you're going to need surgery, and here's why. And so I think that's what's helped in terms of everything that's been built from community support. I mean, when we first started, I would go door to door and just knock on my door, or knock on people's door and say, hey, I'm Aneesh Garg. Here's my background, right? Like, I graduated from Yale from residency. I graduated from Andrews for fellowship. I'm a 2-sport U.S. national team doctor, and I'm knocking on your door to say, hey, how can we help you? What can we do? We're here to be a resource for you and your people. And that's how we built it. I mean, that's how Dynamic Athlete was supported, was through building relationships. And so when you're not tasked to pump 50 patients in a day, and you have time to figure out what's going on, then I think there's a real path forward to making meaningful change and being able to do this. So I think that's really the big thing, is we're trying to take care of the person in front of us. And there's no agenda on our side. It's about, how do we fix the problem that's in front of us and help the person that's in front of us, not just the number, not just, oh, this is an ACL tear or this is a rotator cuff tear. No. This is this person who wants to get back to this because this is important. And we go from there. And we talk about what costs are involved, where people pay a cost one way or another. So either there's an investment in your health and your body, or you say, no, it's too expensive, but I'm willing to pay for my opportunity loss where I can't play with my kids. And I think sometimes that becomes a little bit of a struggle. But we're trying to give options for people that want to avoid surgery, that want to buy back their time, right? So now they're choosing to buy back the most valuable resource that any of us have, which is time, and kind of go from there. So that's really the big thing. And that's what we wanted to do, was be a resource. And the reason that we've started the Regen Doc podcast is to be able to help you make sense of regenerative medicine and what questions are out there. We're going to talk about a whole host of different topics, including steroid injections, or what about surgery, or peptides, or things like that you want to know about, that we're going to address and have it be where you're the most informed person that's out there. So part of this, go to dynamicathlete.com, read up about some of the things that we're talking about. I didn't even talk about some of the things that we do, but this is something that I wanted to share, how we started this practice, having known no one, out of thin air. And we now are doing regenerative medicine in a way that combines multiple biotechnology components to help people buy back time. We're looking forward to seeing you guys next time. Take care.